it's very important to reach out. And one conversation can sometimes make all the difference, particularly if it's with another carer or someone who cares themselves and can help you what problems that they've had, maybe the ones that you're going through. We have to pace ourselves during this next few weeks and months. We're coming up to Christmas at this point in the near future. And if you ever find yourself in a point where you're not sure, you've got a problem, contact us. One last thing is hardship. There are circumstances in which carers find themselves in short-term, significant financial or other hardships. They don't not know what to do and they don't know who to turn to. And we invite you to both turn to ourselves at Carers Trust Solihull or contact the council on its key telephone line. If you're not sure how to do these things, come to us. If we can't solve your problem and support you in the issue, we know some people who will be able to. There's a lot of work going on behind the scenes in charitable sector to try and support vulnerable families and vulnerable and isolated individuals. And we've found that in the people that we directly contacted ourselves, we did over 650 direct contacts and another 200 people who contacted us. I would say on average, 85% of them, once we finished talking with them and they'd shared with us, we didn't have any long-term problems and they knew where to turn to when they needed help in the future. There was probably 15% who were really struggling, and it was mainly emotional. And again, having someone to talk to and someone to bring back and check in on them, which we were quite happy to do, relieved the stress and anxiety and helped us to work with them to overcome whatever difficulties they faced. And that left a couple, perhaps 1%, maybe 2 at a push, who were really struggling on the day and needed a solution on the day. And I can tell you without any doubt that we could facilitate those solutions almost immediately. In some cases, the same day. In most cases, I should say the same day, perhaps the next day if it was particularly difficult. So again, if you are stuck as a carer, you're not sure who to turn to, you may not want to turn to your own family, you don't want to put them under any other pressure. We are here, we're a charity, we're here to support you. And if you want to ring us, feel free to do so. I think if I just bring in my colleagues here to talk about the support services that are available that they're aware of in, say, children's services and in public health services and available more broadly. So, Tim, is there anything you would like to add to that?
Thank you, Brandon. Yes, I think just to reiterate the need to both look after yourself, but also actually it does fit in the second lockdown that it's tougher than the first in many ways. But I do think that as we approach Christmas, there's a real sense of hope actually, and as we reach the spring, we'll see things transform again, I think, and we'll see a new sense of hope that will be sweeping across the country. So hang in there, because I think you're absolutely right. Just reach out to those until we reach that point. Make that phone call, speak to those people that you may not have done for a while. But you're not on your own, so don't suffer alone. You don't need to. There's lots of support, and Denise will give the helplines again in a minute, I'm sure, when she comes in, and the numbers. But there is lots of support out there, and we're all in this together. We really are. And I think by working together and by being with each other, we can make sure that we get through this as safely and as quickly as possible. Thank you, Tim.
Denise, would you like to add anything?
Yeah, and just to say, people who've got any support needs at all throughout this period, there is sources of support available from the council website. That is at www.solihull.gov.uk. On the homepage, there's a bright blue bar that says COVID-19. If people click on that, there's a link to the Here to Help pages. That's here, the word here, the number 2, and the word help. And that will take them to a whole range of different links for support services around mental health and wellbeing, around, we've said before, the practical support around getting shopping, if people are shielding, the lifts to medical appointments, that kind of thing. The links are there, and also links across to lots of other things they may not have thought about that may be of use and help and support to them to make this tough period a little less tough. And just to reiterate those helpline numbers, so the council number, if anybody is needing support or assistance with practically any issue, we can put people in touch with a whole host of people in the community that are offering support and advice, and that is 0121 704 6000. That takes you through to the Solihull Council, and they can put you in touch with people that can help. But also, if you're having to self-isolate for shielding reasons, or if you've tested positive or someone in the home has tested positive, there is the NHS volunteer responder number, which is 0808 196 3646, open from 8 in the morning till 8 in the evening every day. They can help with a lot of issues. If you've got young carers that may just want somebody to talk to on a whole range of health and wellbeing issues, we also have Chat Health, which is a text messaging service, and they'll get a response back within a working day from our school nursing team that can offer help with a whole host of different health and wellbeing needs. And that number is 07520 615 730, and they can text that number and they will get a response back tailored to their specific needs. It'll be for them alone, and they can take the support and advice forward from there. Also, if we've got young carers that have got issues with emotional well-being or mental health, they can actually also access our online counselling service called KOOTH, which is KOOTH. If they search for that online, it does give them that online kind of care and support for their emotional well-being and mental health. They can access it at any time, which is really important for our young people aged 11 to 25. And Chat Health is for 11 to 19-year-olds. So the support is out there, and absolutely echo everything Tim's just said about we're not alone in this. There's an awful lot of support and advice available, and helping people feel connected at what's been a really difficult time for them.
Thank you, Denise. Just to emphasize yet again, if you find yourself in need of support, if you're not sure how to contact these organizations, or you're not got the confidence so to do, or you just don't know what your needs might be, you just want someone to talk to about them, just to ask for basic information. Things may not be that difficult at the moment. You just want to know what your options are. Again, you can ring Carers Trust Solihull. The numbers should be displayed, but a gentle reminder is 0121 788 1143, and you can speak to us, to our staff, who have got lots of knowledge, and some of them are carers themselves. We've been working with carers for, I think, 98 was when the charity was established. Got loads of expertise, and just to emphasize as well, it can be a bit of fun as well. You can organize activities and events, sometimes on the internet. Sometimes we can just ring you back if you want some, just someone to check in if there's a problem that you're trying to deal with, but you just want to know someone's there. We are there, and you can contact us at any time. Thank you. We've